Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and today we're going to show you a little case of placing a Perma facial implant by Sirgisil. These are lip implants. They come in 3, 4, and 5 millimeter diameter and 3 lengths to accommodate the width of the lip. They're made out of a very stretchy and natural feeling surgical silicone, and we're going to go ahead and place one of these for you, so stick around and watch us do our job. So today we're going to put in a PermaFill implant by Sirgisil, lip implants, and these come in a 3 millimeter, 4 millimeter, and 5 millimeter diameter size, and then they come in varied lengths. So the company supplies a little ruler here that has the 5.5, the 6, and the 6.5 length. And when you measure this on a patient, you have to take into consideration the curvature of the lip. So this patient, we're going to use a 5.5. And we have topical anesthetic on this patient now, and we're going to do a little local anesthesia. And open for me here. Now close. So we're just going to get inside the underside of the lip and just put 1/10 of a cc across here. This is what we do for our fillers as well. Just up in the vestibule, it's a little dental infiltration. And this will be our preliminary local anesthetic injection. And then after this gets numb, we'll come back and numb the center of the lip. We're going to be putting this in through the commissures, so we want a little bit of local anesthesia in each commissure. So that's our preliminary local, and we'll proceed. Now we're going to do our secondary local anesthesia, and this is, you can see we have blanching right here. So what we want to do now is put our local anesthesia in the central part of the lip where the implant is actually going to be placed here. So I'm injecting right in the lip, and because we've done our primary anesthesia, the patient can't feel any of this. We're using the Elman radio wave surgery here. You could use a scalpel or a pair of scissors, and we're going to make a small incision inside the commissure, and we want that to be more inside of the mouth than outside. All right, and at this point we'll take our iris scissors and start our dissection. Now we want to be in the center of the lip, and this way we'll be avoiding the labial artery. What we're going to do is take up a 20 gauge fat injection cannula, and we're going to do a little progressive dilation here. We're going to just put this through the center of the lip, and this is just how we would inject fat, or we use this for filler as well. So this is our first dilation. This is a liposuction infiltration cannula. We're going to use this now to define our pocket. And it's very important that once you get in your tunnel that you stay in the center of the lip. We have our expanded tunnel through both sides, so we'll take this out and we'll insert the implant. And we're going to do this by using a small tendon passer, and we're going to insert this through our previous tunnel, and it's extremely important to stay right in the center of the lip. Here is our 5 millimeter, 5.5 centimeter implant, and at this point we're going to put it in the jaws of our tendon passer, and what we want to do is gently pull this back through the incision. And as we do this, we want to pull the lip and unfold the lip. Pull the lip apart like that. Yeah. Okay. Let go now. And you don't want to tear the implant, so you have to be very careful not to do that. Okay, so what we're going to do now, well, the implant is in there. We want to pull laterally and kind of massage it out. And you can see the tip has disappeared, and now we'll let go of this side. Now both tips have disappeared, so our implant is inserted. It actually really only takes a couple minutes, and although it looks kind of invasive to somebody viewing this, it really isn't. So we're done. Now what we want, the commissures on both sides with several sutures. The reason that we put our implant is placed, it's symmetric. You can see our sutured incision on the left and our suture incision on the right. And it's important now that you tell these patients they don't want to pucker, drink through a straw, kiss. We want to really keep the lip animation to a minimum for the next 2 or 3 days so the implant doesn't shift. And that's placement of a Sirgisil implant. I'm Dr. Joe Niamtu, lovethatface.com.